New COVID-19 cases in the country are relatively lower lately, but can we expect this to continue? Let's get the answer to that. We have with us this afternoon OCTA Research Fellow, Professor Guido David is joining us via Zoom. Professor Guido, good afternoon.
Hi, good afternoon, Riza.
Sir, can we say that we are now on a continuous downtrend in cases?
Well, cases are continuously decreasing, Riza, and we're down to about 1,000 cases per day in the country. As we predicted it will happen by first week of March, and it is the case. But we're hoping, of course, that it will continue to decrease. And in some countries, they have reached a plateau. I mean, instead of continuously decreasing, for example, in South Africa, it plateaued for a while at around 3,000 cases per day. This is not yet happening in our case. We're still seeing a decrease, although the rate of decrease has generally slowed down in many areas of the country. So what that means is, well, we're not sure if it's plateauing or just the rate of decrease has slowed down.
Professor, as to what factors can this decrease be attributed?
Well, we believe that we have achieved a level of population protection in the country. So this is due to vaccination and immunity from infections or for people who got exposed to Omicron. So, and we know that it's primarily Omicron because in many other countries that are still seeing a surge right now, especially in Southeast Asia, the variant that they're seeing is the Omicron. So that's what's happening in Hong Kong, in Indonesia, and in many other Southeast Asian countries.
Professor, you mentioned those areas like Hong Kong, we've seen a surge right now. Are there any indications of a possible surge again here in our country? And if yes, when do we actually expect that?
Well, we're hoping that there will be no surge. I mean, of course, there are going to be two possible sources or reasons for a possible surge. One would be a new variant. We're not seeing a new variant yet. But the second one, if we're not careful, and this is why we still need to continue to observe minimum public health standards. The second possibility is due to waning immunity. So I think I mentioned a while ago that that's primarily the reason we're seeing a downtrend in cases because of immunity through natural infection and through vaccination. But we do know that, or at least based on data from other countries, for example, Israel and the US, that after about 3 months, this immunity may decrease. And as long as the virus is still here, it could cause it's possible that there could be a resurgence due to waning immunity. And that's why having booster shots is still very important to protect our population.
Professor, are there still any areas that are registering high COVID numbers?
Well, with less than 1,000 in the country and around 200 more or less in the NCR, we're not really seeing any specific area which is still registering high COVID cases, but there are still areas with still significant hospital occupancy. These are few, scattered all over the country, and there might be different reasons for certain regions having still high hospital occupancy. Some areas still have a fairly high positivity rates. So these are somewhat of a concern, but overall, I think, and as we relax the, restrictions because we need to open the economy, there are other, more important concerns right now worldwide, like the conflict between Ukraine and Russia and the economic impact that this will cause. And that's why, part of the reason we strongly support reopening is because we want to lessen the impact of these events, these international events on us. But at the same time, even though cases are low right now, as mentioned, people should still be mindful of public health standards. we should still wear face masks, especially indoors, so as not to so as to prevent a possible surge in cases, especially if the vaccine efficacy starts to wane.
Professor, the Department of Health says it will release COVID-19 bulletins only once a week moving forward. How will this affect your monitoring?
Well, we'll not be able to monitor the trends if we're not getting data. I mean, we'll still get data from other sources, but the national
Audi.
database is very, very important in our monitoring.
All right. Thank you for sharing with us those information. That's OCTA Research Fellow Professor Guido David.